Good afternoon. On behalf of Mercer University's Center for Career and Professional Development, welcome to today's webinar. My name is Cindy Strobridge, Director of Employee Relations and Special Events, and I'll be the moderator for today's webinar, Insider Tips for Healthcare Hiring. At this time, all participants are in listen-only mode. The webinar is expected to last approximately 40 minutes, and questions will be addressed at the end of the presentation. If you have a question, you may submit it in the Zoom chat box feature. At this time, the presentation is being recorded. You'll be able to view the recording later on our YouTube channel, and a link to the recording will be sent out to participants. Now I'd like to introduce you to my Mercer colleague, Kim Meredith.
I'm so delighted to be presenting the webinar today with some good colleagues. My name is Kim Meredith. I'm the Assistant Director for the Mercer University Center for Career and Professional Development, and I'm excited to get to present insider tips for healthcare hiring today with my good colleague Cindy and our guest speaker and great colleague Catherine Andrews. Allow me to introduce her to you. We've known Catherine for a few number of years. She attends our career fairs and is a great champion of Mercerians and your career development. I'm so grateful for her time today. Catherine is the Human Resources Specialist at Grady Health Systems in Atlanta. She has 15 years of experience in human resources, spanning across the nonprofit sector and hospice for most of her career, to include HR roles at American Red Cross and Embracing Hospice. Catherine joined the Talent Division of Human Resources with Grady Health System in June 2017. Her client groups include pharmacy, OT, PT, speech and rehab, as well as Georgia's Poison Center, oncology, the trauma program, nutrition, radiology services, and sickle cell. She has formerly worked with the cardiac clinic, the cath lab, the supplemental staffing, and med-surg. In Catherine's spare time, she reviews resumes, provides interview prep guidance, and suggestions for networking to job seekers. Catherine volunteers actively with Big Sister and with Big Brothers, Big Sisters, and also with American Cancer Society and Kate's Club. Today, I'd like to welcome Catherine and thank her for participating. Before I turn it over to her real quick, I want to go over just a little bit about our goals for today's webinar. You know, the main thing for today is for us to be in a great position to offer our Mercerians insider HR perspective, you know, from the other side of the desk, the perspective to help job seekers. So for today, we're looking at providing you with tips to develop a modern resume, one that's aligned for a career change to or advancement in healthcare, to share tips for a successful healthcare interview, explain the value of proper business etiquette in all endeavors for job seekers, as well as to inform participants today about career paths at Grady Health System. So I'd like to turn it over to Catherine real quick, but before I do, I see there's a poll that we have launched indicating your area of study. Thank you for participating. And honestly, Catherine, it looks like there's a split, pretty even split with business, counseling and human services, health care and health professions. Looks like we have one healthcare leadership major participating and a couple of health informatics. We have a few nursing students, and I'll share those results so you can see real quick on the screen. Gives you an idea of who is in our audience today as you customize your tips that you'll share. I hope everybody can see these results. I'll stop sharing those now, and we will proceed. So Catherine, without further ado, let me turn it over to you.
First of all, I want to thank Kim and Cindy and Mercer University for this opportunity. Very excited to share tips of the trade and things that I've learned over the years, not only as a recruiter myself, but when I was a job seeker throughout my career. So very excited to share those tips with you today. My story is probably very similar to a lot of you. I graduated with a bachelor's in psychology, which is one of those generic degrees. And so when you graduate, you think, well, what do I do? Where do I go? What do I apply to? And so one thing I did know was that I was not interested in counseling or teaching at that time. And so that helped to start to steer what path I was going to take in my career. And so like many of us, you apply to every job that sounds interesting, every company, every job title that sounds interesting. And unfortunately, that's not always the best route to take. And so I learned that after a few months and actually went the agency route, a suggestion that was given by a family friend. And so the very first job out of college was with a health insurance company. And I was an administrative assistant, and I was able to demonstrate very quickly my skill set. And so I was given more responsibilities to help start to kind of elevate my career. So I was very grateful to them for that opportunity, because that then led me to my next position that I held with a health and wellness company. And so having been a student at that point for my entire life, the 8 to 5, Monday through Friday schedule was very grueling. It was almost easier being a student. And so I really struggled when I was with the health insurance company, having to get up every day. And so when I found this health and wellness company and learned that I was going to work different type of hours each day and not work every day of the week and have a day off midweek, that definitely appealed to my naivete, if you will. And so I was with that company, and I helped people to live a better wellness life. I'm not sure how else to put that. From that position, in my personal life, I was volunteering with a youth organization. And one day, my point of contact came to deliver materials for a project that I was working on. And she came by to drop them off, and she asked me how I was doing. And it was very odd, because that question she had never asked before. And it was as if she knew that I was ready for a career change. And so when I told her that I was job searching, she mentioned that there was nobody to be a full staff person, not just a volunteer, and that she was going to recommend me if I was interested. And so then that's what led me to the nonprofit youth organization that I was with. And I ran their after-school program and a summer program, and booked the field trips, did the payroll, hired the staff, trained the staff, managed the staff. So that was certainly a great opportunity. And then from there, that led me to nonprofit with American Red Cross. That's where I spent the bulk of my career. And I started off recruiting volunteers. And then after, I forget how many years, I was then promoted to the supervisor of the department. And then that's where I ended, and then moved into hospice. And with hospice, the same thing, recruiting. And so between going from Red Cross to hospice, I was wanting to get into corporate recruiting. That's ultimately where I wanted to end up. And so it's all about timing, as many of you know when you job search. And so the timing wasn't right. And so that's how I ended up in hospice. And when I was working in hospice, I still kept getting that calling, that corporate recruiting is where I'm meant to be. And so it was, again, all about timing. And so when I was ready to make another transition, I gave it another attempt. I changed up my resume, which I'll get into. And that time it worked. That time I was able to successfully make the transition from nonprofit recruiting into corporate recruiting. So definitely want to say to never give up, because sometimes it does take more than one chance in order to make that come to fruition. So now going into our first slide, which is resume tips. So information to include. So for those of you that are in professions where professional license and certifications are required, to make it easy for a recruiter and a hiring manager is to include your license and certification information on your resume, especially if you have a very common name like Mary Jones, because it makes it challenging for us to be able to decipher in the system, is this the Mary Jones that has a license or the Mary Jones whose license has lapsed? So certainly make it as easy as possible as you can for the recruiter. When it comes to information to not include, this can definitely be a very sensitive topic in terms of who named you, how you were named, and so we're very cognizant of that. And so certainly to not be insulting to one person's nationality, race, or ethnicity is to keep in mind what makes the most sense on a professional level. So if there is a nickname that you have and you do not want to utilize your given name because it may be difficult pronunciation, for example, to have a nickname that again sounds professional, that's not something that you were called as a child. Because you don't want that to be a reason why a recruiter or manager doesn't call you, because the name that you chose for your resume is not something that's deemed as appropriate. So keeping that in mind. In terms of how many pages is too many. So my rule of thumb is if you're a brand new graduate, your resume should be 1 page. When you are mid-level, your resume should be 1 to 2 pages. So mid-level, I would classify as someone who has about 7 years, certainly less than 10 years. Once you hit that 10-year mark and more, what we would call an advanced job searcher, your resume should certainly be 2 pages plus. And I understand the taboo about dating yourself and ageism, and that's certainly a concern for all of us. And so there are some things that you can do to try to get around that, to not completely date yourself, but you also don't want to shortchange yourself, because if there's something that you left off your resume that is what a particular company was looking for, and that's the resume that you provided that company, and that ends up being the reason why you do not receive a call, or you don't receive a call for that second interview. So it sometimes can be a fine line that you walk. In terms of email address etiquette, I will be the first to let you know that if, and I've come across this unfortunately, if your email address is not appropriate, so certain words or certain phrases, and so again, you do not want that to be the reason why you do not receive a phone call or an email inquiry. So keep it simple, use your initials, your full name, or a combination of that. Numbers and dates that might have meaning to you, certainly use those as well. But keep in mind that when it's spelled out, take a look and have someone else take a look as well to make sure that it does not potentially have a hidden meaning that you're not thinking of. Because again, you don't want that to be the reason why you don't receive a call. And then in terms of types of resumes, the one that we most know, are most familiar with, is the traditional. And so that's where you're listing your work history, your skills, your soft skills, your accomplishments, things of that nature. But what I want to focus on is job specific. And so as I mentioned in my own personal career path where I was able to transition into corporate recruiting, this was the type of resume that I utilized. Okay, so if you are, take a look at this type of resume, this is what I call a job specific. And so the reason, or the benefit I should say, for utilizing this type of resume is that recruiters and managers, it's out of habit that you're focusing on the name of the company, the type of company that you worked for, what your job title was, what some of your responsibilities were. And so when you're making that transition, it may not make sense why someone who is working at a hospital is now wanting to transition into an advertising firm, because a manager and recruiter may not see what that connection is. So you want to take the focus away from the companies that you work for and what your job title was, and you want to show what your transferable skills are, to show that even though you worked at a hospital and you now want to work in advertising, you're able to show the connection. And so that's why I call this a job-specific resume. And so for this example that I gave, for this particular person, what they were transferring from was administrative support to healthcare, information, actually informatics, actually. And so under the skill summary, that's your traditional information that you include on a regular resume. But what I want to focus on is the experience highlights. And so what she did was, for the position that she was applying to, she took from that job posting to see what were the top 4 areas of responsibilities. And so they were administrative, medical manager, and customer service. And so what she did was she took what her job responsibilities were from the various jobs that she held and grouped them into different categories. So that makes it very easy for the reader to be able to follow what her skill set is, her soft skills as well as her hard skills. And then under her professional work history, that's where she indicated the name of the company, her job title, and then the duration that she was with each company. And then I also always encourage to include city and state as well. And when it comes to duration, it's always best to include month and year, not just the year. So that way, again, a recruiter and hiring manager can have a really good idea as to exactly the length of time that you were with an organization. And then the last area is the training and certification. And so for this particular person, that they have a couple certifications and then also with their education. And so again, as I mentioned before, when it comes to a professional license or certification, again, you want to make it as convenient as possible for the recruiter. And so to list the registration number, list the exact name of the certification, the expiration date, and then even list the date that you first obtained that certification or license. So again, a recruiter and manager are able to see exactly how long you have maintained that license. A couple other things that I wanted to mention, and again, things that sometimes we forget about. So grammar, punctuation, and I always tell this to job seekers, recruiters are always looking for a reason to not contact someone. And so just to give you an example, one of the positions that I recruit for is an administrative research and data analysis position. And so it requires almost 100% accuracy. So when they are doing their data analysis, they need to basically not make any mistakes, which, as we know, being human is next to impossible, but that's the type of position that this is. And so when we receive resumes where there's grammatical errors, punctuation errors, and they're applying for a data analytics position, it's hard to convince a manager to review the resume and contact that person, because what was on paper certainly is probably prerequisite as to how they would perform on the job. And so I always recommend to job seekers to have more than one person review your resume, because 6 sets of eyes is better than 2 sets of eyes, because they're going to see something that you may not have seen, and then also they're reading your resume from a different perspective. And so it's always better to have more people read than not enough. Make sure your timeline is correct. And so again, you don't want to jump around. So again, if you're focusing on a job that you had that is well matched with the job that you're applying to, and you want to list that one first, but that job is something that you had at the beginning of your career, and now you're going out of chronological order, that can definitely be a little frustrating to be able to follow someone's timeline of their employment history. And so again, using the job-specific resume might be ideal in that example. But when you're doing a traditional resume, you want to list your most recent job first and then go backwards. Another thing to keep in mind is to know what you're qualified for and to apply to those positions. The job may sound interesting, or it's a job that you would like to do ultimately, but it may not be the right time in your employment history and your employment path to apply to that position. Maybe you need more schooling or more experience behind you before applying to that position. And so again, there's nothing wrong with asking those questions because you don't want to insult someone by applying to a position that you truly are not qualified for. And so the best thing to do is to always make sure that you've researched that first. When it comes to designing your resume, again, something that I always mention to job seekers is that think about when we're printing 50 resumes at once and how printers cannot cooperate, resumes get mixed in with another resume. So you always want to make sure that you have your heading on every page. And you'll see with this example that I gave, to have your name, your phone number, your email address. If you include other information in your heading, it's not necessary to carry that on page 2, page 3. Really, it would just be your name, phone number, and email address, and then number your pages is another thing to keep in mind. Because again, thinking about if someone's printing your resume, what's the worst case scenario? And you want to make sure that your resume, if it does get mixed in with someone else's, that they're able to identify which page 2 and page 3 belongs to your resume versus someone else. Okay. So moving to the next one. So interview tips. Something that I've come across recently is a handshake. And so I decided to start with that, the value of a good handshake. What do you think a handshake says about you, the reason for the handshake? That's kind of where I'm going with this. And so when it comes to giving a good handshake, and this is in networking too, not just when you are having your in-person interview, is that you want to take the initiative. So even though you were the job seeker, you're the interviewee, by you taking the initiative, one, that's something that certainly a manager or someone behind the table at the job fair is not expecting. And then you want the handshake to be firm, and you also want to make eye contact. And so even though you are marketing yourself, and that can definitely be very intimidating because you're trying to sell yourself, you want to show that you're not intimidated. So don't let them see you sweat, I guess is a really good phrase that applies here. It's just something that I wanted to mention. I've attended a fair number of job fairs every year, many of them at our local colleges here in the Atlanta area. And I cannot tell you how many times I've met people that will approach me and I extend my hand and they don't shake my hand, or the handshake is not what I was hoping. The eye contact is not there because they're very nervous. And so you want to rehearse. You definitely want to rehearse so that you can come across as confident as possible. Research the company. So when you accept the interview, make sure that you know the job title that you're applying for. And if you have the opportunity to go back and review the job posting so that you can have an understanding or remind yourself what the job is. And then research the company, research the hiring manager if you're able to do that. So now with social media, this is where social media can definitely be a benefit to us. So you can have an idea as to what their career path is, because certainly in an interview, while they're asking you, why should we hire you? You should certainly ask them, why did you interview for this company? You know, in your career path, what brought you to this company? And so it shows that you have an interest in it where it's not just a job, that it's more career-minded is what you're looking for. Topics to always discuss. Certainly you want to talk about progression. You want to know, is there room for growth? So that is alluding to the fact that you're not just going to stay for a year, 2 years, that you're wanting to kind of plant your feet and stay for a while. Accountability, again, goes to wanting to know what are the responsibilities, what is asked of me, and how am I being rated? How am I being judged? Because that's in essence what's happening. And then what type of feedback am I receiving so that I can continue to improve and excel? What is the company looking for? And this is a big thing to note. So you want to find out, what is the company looking for? So yes, so take my position, for example. Yes, you're hiring for a recruiter, but what type of person will be successful as a recruiter? Because every company has a different focus when it comes to the type of person that they would hire for a recruiter, because not everyone is a cultural fit, a company fit, patient fit. So you want to ask those questions so then when you're providing answers, you are able to demonstrate how you are their solution. So it's not that a job seeker and they have an open position. You want to marry the two and be able to explain how you are their solution.
Sorry about that, everybody. I think we have Catherine back. Please proceed.
Yes, okay. Again, I am so sorry for the technical difficulties. So the next topic was topics to never discuss during an interview. So again, salary, especially when it's your first interview. If it's your second or your third, that's a different conversation. But the perception as a job seeker to understand from a hiring manager and a recruiter is that you're looking for a certain salary. So it's not necessarily the company, what the company's values are compared to what your value system is, what the job is, what the expectations are, how it's going to help you to grow in your career path. You're more focused on the salary. So that's the perspective and perception that a recruiter and a hiring manager have when that's one of your very first questions that you're asking. So it's all about timing in terms of when it's appropriate for a job seeker to ask about salary. PTO package is another item if you're wanting to know how many vacation days you're going to earn. Because again, if you're offered a job where you're only given 10 vacation days versus another company that gives you 20 vacation days, why are you selecting the company that gives you 20 vacation days? That goes to show that the actual job is not what is most important to you, that it's something else. And so again, there's a time and place when you want to ask about the PTO package so that the focus stays on, again, you being the solution to the company's problem, which is the job opening. And benefits, the same thing. It's okay to ask, do you offer benefits, medical, dental, vision, 401k, tuition reimbursement, but it's not okay in the very beginning to ask, what are the payroll deductions? Can I sign up my spouse, my domestic partner, my child? Again, that's a conversation that's better suited as you're going down the line and you're coming to the point where a job offer is going to come your way. Then that's when it's appropriate to ask those types of questions. When you're preparing for your interview, again, it goes without saying, but it's always good to hear the reminder to have pre-planned questions. Whether you have them written down or they're memorized, you should always have questions in an interview. It never alarms and sends a red flag to a hiring manager when they explain everything and you cannot come up with at least one question to ask, because they're thinking, did they listen to anything I said? How do they not have a question? They don't know anything about this position in terms of they've never worked a day at this job. How do they not have a question? And typically recommendation 3 to 5 questions is appropriate. If you have more than that, then by all means ask those questions, but certainly to not send up that red flag, 3 to 5 questions is definitely appropriate. Take notes during the interview. Because again, it shows that you are being engaging and that you are interested in the information that they're sharing. Your elevator speech, I'm going to get into that with our networking, but your elevator speech, you actually want to start off with your interview. And so you want to be able to not only say who you are, and what your backstory is, but you want to be able to rehearse it so that you sound well polished. You do not want to stutter too much. You don't want to take too many pauses, because again, when you think about from the other side of the table, what is the perspective of that recruiter, of that hiring manager? And so you want to come across as confident as possible, even though you could be as nervous can be. Definitely bring resumes with you, and please make sure that they're updated. It's definitely taboo to come with a resume, but then have to say, I'm sorry, this is not my current version. And it's also okay to even ask, is this a panel interview? Am I interviewing just one person? And if they're asking what your motivation for that question is, just let them know that you want to be prepared for the interview and you would like to bring appropriate number of copies of resumes so that everyone can have a resume during the interview. So that can be kind of a way to get around that. When you're interviewing, and again, just some reminders that people don't think about is your voicemail box. I'm currently working with a few candidates right now whose voicemail box is full and they have not cleaned it out. So I just send them an email every time I need to get a hold of them. But when you are job searching, please make sure that your voicemail box is empty so that people are able to leave voicemails. It's not something that we think about because in our personal lives, we very rarely use voicemail anymore, but on a professional level, voicemail is readily used. And so you want to make sure that you're not missing out on anything. And then your voicemail greeting. Early on in my career, I recall a few people who had very inappropriate greetings for their voicemail. And after listening to it, I decided I was not leaving them a voicemail. And if the person ends up calling me back, then I took the opportunity to use it as a teaching session and explain to them why I did not leave them a voicemail. Some people were receptive and thankful, and they changed their voicemail greeting, and others didn't see the point in it and just went on their merry way, and I wish them well in their job search. But again, you do not want to insult anyone. And so because your voicemail is used for personal and professional, you definitely want to keep that in mind. And when you're leaving a voicemail, please make sure that you're in a space where you can be heard, that you're not in a tunnel underwater. And if you need to, hit the pound button and start over, it's okay. You might have to actually do it a couple of times before you find the message that you like, before you decide to have that message delivered. Okay, moving to the next slide. Networking tips. So as I mentioned before about the handshake, the next thing I wanted to talk about was the elevator speech. So 15 seconds versus 30 seconds. And this is actually something that was told to me early on in my job searching career. And so the 15 seconds is for someone who in passing may ask, what are you looking for? What jobs are you applying to? You want to be able to have something already prepared, ready to go. The 30-second elevator speech is going to be a little bit more developed, obviously more information provided, and that's when you're in front of someone at a networking event, at a job fair, and as I mentioned before, when you're interviewing, when it's your turn to talk, to open up with your elevator speech. And just like, the music artists, when they say that they're recording artists and looking for a music deal and they're asked to, sing on the spot, they should have a song already prepared. When you're a job seeker, you should have your elevator speech already prepared, that 15-second version and the 30-second version. Know the types of jobs that interest you. So you have industry versus job type or job title. So to know that there is a distinction and the distinction matters. So for example, I'm a recruiter in healthcare, but you have recruiters in other industries, automotive, education, government. And so you want to be able to explain why you want to do the type of work in a certain industry. Again, research the company, know what they do, know who they are. Again, social media, in this instance, again, is your friend. Definitely utilize it. Who should you call? Who can you call? Do your research. So when I networked to find my job with Grady Health Systems, it actually was all through networking, and I used LinkedIn primarily. And so I researched people that had the job titles that interest me, job titles that I wanted to have, companies that they worked, the companies that interest me, and then also the industries. And that's how I was able to network. And through that networking, eventually I found my way to an individual who had a connection with Grady Health System. And then that's where I found myself 2.5 years ago. Again, with the email etiquette, your email address, and then also when you're creating your email, you want to remember the who, what, where, when, why. Same thing with the telephone etiquette. So please don't call someone and say your name and then stop and wait for the person on the receiving end to, one, remember who you are, remember that you spoke 5 days ago, remember what your voicemail was, and then you were just calling again to follow up. You want to take all of the guessing out of it. So you want to, again, state the who, what, where, when, why. Leave a voicemail. Please don't hang up and call back. That's what we do with our friends and family. This is your professional life. You want to keep it separate from your personal life. And so the worst thing you can do is call every 15 minutes, every 10 minutes, and never leave a voicemail, hoping to catch the person to pick up. What is more appropriate is leave a voicemail and wait. Give that person time to call you back. Another thing with email is to create your emails, put them in draft, go back, revisit again to make sure that the email content is as clear as possible. And then I always tell people, send your emails at odd hours. So if you don't want the email to, because it's so easy if you receive 100 emails a day to overlook an email. So if you want your email to stand out, send it very early in the morning, very late at night. So that's kind of a tip in the industry to make sure that your email is not overlooked, is to not send it during the middle of the day, especially if you're brand new to that person. They don't know who you are, your name is not recognizable. That's something that you can do to stand out from other folks that are emailing as well. So when it comes to networking, remember that this is a competitive market, and so networking is probably the best way that you're going to land your next job or every job after that or your first job. And so again, using LinkedIn, professional organization, so based on the industry or the job that you have, do your research to see what type of networking groups exist. And if there's a nominal fee, it might be worth it to pay the membership fee. Many of these groups, you can at least attend one meeting for free. A lot of groups through Meetup and social media, they're actually all free. So you just show up and maybe you have to, buy a glass of wine, that sort of thing. But it's always good to be able to rub elbows with whoever you can to, again, be able to tell your story, your elevator speech, so that, because the more people know that you're job searching, the better off it's going to be for you. And with Mercer University and their amazing alumni and their career development centers, utilize those resources as well. Please don't, when you graduate and you move on, please don't forget about the alumni connections and how they can also help you as well. And then one thing that I just wanted to mention about when you attend a job fair is never ask a recruiter, what are you hiring for? Because it doesn't matter. When it comes to healthcare and other industries where it's black and white, meaning that it requires you to have a certain degree or a certain license or a certain certification, it doesn't matter what you're looking for. Because if you don't meet those requirements, I can't hire you. So the best thing to do is, again, have your elevator speech and then ask the question, what am I qualified for? Versus asking, what are you hiring for? And then always come prepared, have a current resume. Please don't hand a resume and say, oh, this is not current, I didn't have a chance to update it, or handwrite in your additions or subtractions. Try to be as prepared as possible. Certainly things come up last minute when you learn about a networking event or a job fair. But again, if you're job seeking, you want to always be prepared as much as possible through the entire process. So if someone says, email me your resume, you're not having to go and create your resume. You have it already. Dress appropriately. Unfortunately, not to insult anyone's intelligence, but I've had to remind people about that. And if you're unsure, it's okay to ask someone because, again, you don't want that to be a reason why you do not receive a phone call. Okay. And the last slide. So as Kim mentioned, I work for Grady Health Systems. And so for those of you who are not familiar with Grady, we have some distinctions that other hospitals here in Georgia do not have. We're just shy of 1,000 beds. We are one hospital where many of the other hospitals in Atlanta have several hospitals. We have just one building. We are a nonprofit hospital. So that means that we do receive support from local state government officials. We're also what's called a safety net hospital. And so that means that if you do not have insurance or you do have insurance, the doors are open and you're welcome to come and we have to treat you. So that's what safety net means. We are also certified level trauma 1. And so that means the worst cases of the worst cases, those patients want to go to Grady because of the high-tech technology that we have. And so with our stroke and our neurotrauma center, our cancer, our sickle cell center, we actually only have one poison center for the state of Georgia, and they are affiliated with Grady Hospital. Crestview is our long-term care and rehab facility, and it's the only one of its kind in the whole state of Georgia. And again, it is associated with Grady. And then we have a very big initiative with HIV and AIDS to address that population here in the metro area. And then our birth center is actually only one of 2 in the state. So those are just some distinctions about Grady Health Systems. And so the listing here on the screen now, clinical versus non-clinical, and what I did was I just kind of highlighted the most popular areas of where we hire. So obviously nursing, nursing support, and allied health, and a lot of people are unsure exactly what allied health means. So those are your occupational physical therapists, your speech pathologists, your therapists in general, paramedics, dietitians, pharmacists. Those are just some of the main categories that kind of fall under allied health. And then with your non-clinical, you have IT, call center, guest services, and administrative. And so here at Grady, depending on the type of role that you're looking for, it could actually fall under clinical or non-clinical. And this is my contact information. And so as Kim mentioned, in my spare time, I review resumes. I help people interview prep. And so I am more than happy to lend my support, assistance, be your cheerleader, advocate. And so this is my contact information. Please do not hesitate to reach out to me if you are job searching. If I'm not the recruiter for the areas that you're interested in, I can certainly research who that person is and get you in touch with them if healthcare is the way that you want to go. If healthcare is not the industry that you're interested in, again, I'm more than happy to review resumes, interview prep, networking tips, things of that nature, because I've been very lucky in my career path, and however I can lend a hand to the next person, that definitely is one of my mottos.
Thank you so much, Catherine.
You're welcome.
And now we know and understand your sharing spirit, why you're such a wonderful Mercer supporter and a champion for career development for all, and that definitely shows. and I appreciate your offer for support. That is absolutely phenomenal, and I hope that the audience would take you up on such an offer.
You're welcome. Again, thank you for the opportunity.
Yeah, well, hang with us for just a few minutes. We're going to address
Yes.
some questions toward the end. Real quick, I want to give a Handshake commercial to our student and alumni population. Handshake is the free career development platform. It's offered to students while they're enrolled, but it's also offered to all of our Mercer alum, no matter how many years have passed since graduation. Alum just simply have to request an account and let us verify their degree. It's free, and it is the premier career development platform in our nation. So we're very, very excited to have Handshake. It interacts with employers across the globe, much like LinkedIn does. It puts postings in front of our Mercerians. It also acts as a communication tool between our Career Center staff. It's just a phenomenal tool. So what I'd like everybody to do right now is to make a note to go into your Handshake account and make Grady Health Systems a favorite employer so that you can, quote, follow them. And the way you do that is to click the star on Grady's employer page. And what that does in Handshake is it serves as a way to follow, so that when Grady Health System makes a post in Handshake, you will be receiving an email alert about that new posting. You can do the same thing by favoriting any job postings they have already in there. If you favorite a posting, then the email alerts begin to let you know when that position is getting ready to expire. It sort of nudges you. So I find that to be a great tool, and Grady is a great Handshake user, and we love that. There are several of Catherine's colleagues that use Handshake as well. So use your Handshake account and connect with us. If you have your cell phone or your computer nearby and you have just a second, we'd really like for you to connect with Mercer Center for Career and Professional Development. This is where we make lots of announcements and postings about what's happening with employers and happenings. And be sure to use the hashtag that we have this year is Connect to Your Future. And the YouTube channel especially will be important if you're interested in seeing our previously recorded webinars and so forth. And so I think that maybe it's ready for questions. Cindy, I'm going to turn it over to you now.
Great, thank you, Kim. I see in our chat box we already have a couple of questions. So if you do have a question, please go ahead and pop it in here and we'll roll through them while we still have Catherine with us. So Catherine, our first question, someone who doesn't have a lot of experience in the healthcare field, but really wants to get into the healthcare field. This person has more experience in business, but no experience in healthcare and is looking to kind of break in. What are your suggestions to do that?
That's a great question. That is a great question. The first thing would be networking. And so with my own personal experience when I was making that transition into corporate recruiting, was I identified not only who works at companies where I would like to work or has the job title that I would like to hold. That's where I first started. And I would send invitations on LinkedIn, and I had a crafted message. So it's not just sending the invitation. You want to create a message as well. And my question was, can I have 5-10 minutes of your time? I'm a job seeker and would love to pick your brain. So by me acknowledging that they are an expert in their field, who isn't flattered by that? And so I would say in a matter of about 2 months, I probably talked to over 70 people because everyone was so receptive to not only my approach, but my reason for reaching out to them. And then the other thing would be that job-specific resume. And again, I'll be more than happy to talk to you offline about that, but it's to show your experience in business, what are those transferable skills to get into the healthcare industry.
Great. I do have a student who has asked, and I'm going to encourage the student who is wanting guidance and leverage to knowledge their experience acquired through school and work to really either reach out to Catherine as she's provided her contact information, or make sure you come and see us in the Center for Career and Professional Development, and we will help you and guide you through what's the best to put on your resume and how to search for things like that.
Yeah, definitely.
Yeah. So our next question, we have a recently graduated master's student in science and health informatics. They did some research for a job title related to their major, but is still not having a clear time finding that job in their search. So what is a job title related to health informatics that they should search for when they're job searching?
Okay, so at Grady, I actually work with those hiring managers, and that's our trauma program. So that's our data analytics area. And so trauma registrar is typically the job title that's being used. At Grady, we are actually literally, as I speak, making a transition in terms of new job titles based on what the industry is telling us. So please, please reach out to me, because we are currently hiring in that area, and this is for health informatics. And so if you have your HIM certification or your RHIM, I think are the two certifications, please definitely reach out to me, because I would love to take a look at your resume and make suggestions, and then hopefully forward it over to our manager.
Great. This person also has a question about any volunteer positions they can do at Grady related to health informatics.
Oh my goodness, I'm so glad that question was asked, because that was definitely something I meant to mention. That's also another great way to get your foot into the door, is to volunteer. And so if you go to our website, gradyhealth.org, and click on the volunteer page, there's a voucher application that you would fill out. You indicate your areas of interest, and then there's an orientation that you would attend, and then they put you on the schedule. And then again, by volunteering in different areas, it gives you the opportunity to rub elbows and let people know, hey, I'm interested in a career at Grady, because that's actually my story with how I landed the job with the youth organization. I was actually one of their volunteers for 3 years. And then that opportunity came up, and I was able to get the job because they already knew my work ethic as a volunteer. So it was like I was just a shoo-in. So volunteering is a very good way to get your foot in the door. And if you do, let me know, and I will make sure that the volunteer coordinators are aware of who you are and make that connection.
Great, thank you. Now, switching gears a little bit, we have a question regarding nursing, so hopefully you can help with this.
Okay.
Do you know some of the most common questions that are asked during a nursing interview?
Are you talking about what the job seekers should ask, or what the managers are asking?
The job seekers.
So questions that job seekers should ask.
Actually, I think this person was asking maybe what the managers are asking. So if they're searching for a job in the nursing field, what questions will be asked of them when they go into that job interview?
Got it. Okay. And I'm assuming this is like registered nursing they're referring to?
I believe so, yes.
Okay, just for clarification. So if you're a new graduate, what they want to know is what were your clinical rotations? Which hospitals did you go to? Were you able to select, or were they chosen for you? So especially if it's something where you were able to choose where you went, why did you choose that area? Why did you choose that hospital? Because that's going to give insight to a manager as to kind of potentially where you want your career path to go. You also want to apply to jobs that mirror what your clinical rotations were. So everybody wants to work in the ECC, everyone wants to hold the babies. But if you were not fortunate enough to have a clinical rotation in those areas, it's going to be very hard to convince them why you over someone who has that experience. So you want to keep that in mind. And again, transferable skills. So even if you didn't work in the ECC, what rotations did you have that would make you a good candidate for the ECC? You want to take it from that perspective as well. And then also they'll ask, why this hospital? So again, we have how many hospital systems in Atlanta. If you're job searching here, you want to be able to explain as best as you can why you're interested in that hospital. So it's not that it's just a job, it's what is your value system, what are your goals, and to show how they align with that particular hospital.
Great.
So those are going to be the kind of questions that they'll ask. Yeah.
Yeah, thank you. I think that last part is definitely applicable to anyone really searching in the healthcare field. Why do you want to work at a certain hospital or a certain location, and how do your goals align with the goals of that that employer? So great, that's very helpful.
Yeah.
We are close to time here, so if anyone has any last minute questions, I'll give you another, 20 seconds or so to type in, and then we will conclude for the day. Okay, not seeing any other questions coming in. We want to thank Catherine so much for your time today. You've been such a great help to us, really understanding how to navigate the healthcare field systems, and we appreciate your time.
Oh, you're welcome. You're welcome.
We actually have one more quick question. I'm going to let this one more slip in if you do have a quick second.
Okay,
This
sure.
individual is a healthcare leadership major with 8 years risk management experience and a specialization in injury casualty risk claims. What's the best way to translate this into healthcare? And yeah, what's the best way to translate that into healthcare?
Okay. That's another good
I can have
question.
Kimberly reach out directly to you to ask that question if that's a little too
Please,
much.
yes, this person, again, please reach out to me. The trickiness, for lack of a better word, when it comes to healthcare is that there really is not a gray area as there are in other industries. And so if you are in management, in leadership, and that's the track that you're on, many of those positions require that you have actual experience, not internship experience, going along with your studies, something completely outside of that. And so those type of roles, you're having to start at the bottom and work your way up. Those are not the type of roles where you can come in as the director. You're coming in a couple steps below that. But yes, please reach out to me because I would love to talk to you further about that.
Great. Thank you, Catherine, for your willingness to help all of our students.
You're very welcome.
Thank you. And at this time, we'll go ahead and conclude the webinar. We thank you for attending and hope that you come and talk to CCPD soon.